Dear friends, welcome to Dental Education Hub YouTube channel. Today we are going to start important morphological features of the maxillary permanent central incisor. So watch this video till the end. So what we are going to discuss in this brief lecture, we are going to discuss the timeline of development of the maxillary central incisor. We are going to discuss the tooth notation in various tooth numbering systems. And we will also discuss the important morphological features of this tooth from all the aspects. So the timeline of development. So the first evidence of calcification of this tooth or when first time the dentine formation it begins is when the baby is 3 to 4 months old. The enamel is completed or the crown formation it is completed for the maxillary permanent central incisor is around 4 to 5 years, and the eruption the tooth emerge into the oral cavity by the age of 7 to 8 years. And if you simply add plus 2, 8 plus 2, then it's 10 years. So the root is completed by the age of 10 years. So when the tooth it emerge into the oral cavity, only 2/3 of the root is formed, and the remaining root it is completed by the age of 10 years. Now we will study the number of this tooth in three different numbering systems. So in the universal numbering system, the number of the maxillary central incisor is, for the right central incisor, it is 8. And for the left central incisor, the number is 9 years. It is 9, sorry. It's 9. In the Palmer notation system, so this is a Palmer notation system for permanent teeth. So in the Palmer notation system, the number of this tooth is 1 for the right and 1 for the left. But the only difference is this symbol. This sign is only difference to indicate whether the tooth is of the right side or the left side, left maxillary side, I mean. So the third notation system is the FDI notation system. So in the FDI notation system, also known as Federation Dentire International Numbering System, the number of this tooth is right side, right central incisor is 1, 1. It's not 11, it's 1, 1. And for the left, it's 2, 1. So if you want to learn more about the tooth numbering system, I have given a link of the old lecture in the description of this video. So do watch that lecture as well. So now we will move to the identification points or the important morphological features of this tooth. Now, these incisors, they are close to the midline. So that's why they are termed as the central incisors. So these teeth, they are located in the maxillary arch, and because they are centrally located in the midline. So this is the midline, and these are the first teeth from the midline. That's why these incisors are known as the central incisor. So this is the central incisor of the right side, and this is the central incisor of the left side in this clinical picture. Now, the central incisors, they are among the anterior teeth, mean from canine to canine, and same in the lower arch from canine to canine. These teeth are the most widest mesiodistally. So mesiodistally, these teeth are the most widest among all the anterior teeth. So these teeth, they have, together with the other incisors, these teeth, they have a basic function of shearing and cutting of food. Now, from the labial aspect, what are the key identification features or what are the important features of these teeth? So the mesio-incisal angle of this tooth is sharp. So this is one right central incisor. So this is the mesial side of the tooth. So let's write M over here. and this is the distal side, and this is the incisal surface. So the mesio-incisal angle, this is the mesial outline of the crown, and this is the incisal outline. So this angle, it is sharp. You can see clearly this angle is a sharp angle. While the disto-incisal angle or distal incisal angle, this is the distal outline of the crown, and this is the incisal outline. So the distal incisal angle, it is rounded if you compare it with the mesial angle. The root of this tooth, it is basically, it is cone shape. So it is a cone shaped root with a blunt apex. This line, which is present at the junction of the root of the crown and the root, this is known as the cervical line. So the cervical line, it has a semicircular outline. So this is a cervical line and it has a semicircular outline. So cervical line, I have already mentioned that it has a semicircular outline. Now the labial surface of this tooth, there are some additional features as well. So there are developmental line on the labial surface of the crown. You can see there are the developmental depressions or developmental lines that are present on the crown surface. So now these developmental lines, for example, this is the mesial side and this is the distal side. So here there's a developmental line. You can see a developmental line here. And this developmental line is known as the mesiolabial developmental depression. And there's another developmental depression over here that is more close to the distal surface, distal side. That's why we call it as distolabial developmental depression. There are some lines near the cervical line, and these lines, they are known as the imbrication lines. These are known as the imbrication lines. So the mesial outline of the crown and the root, it is nearly straight or slightly convex. So this is the mesial outline of the crown and the root. So the mesial outline is, it is slightly convex or it is nearly straight. While if you see the distal outline, so the distal outline, it is more convex. So, or it is more rounded if you compare it with the mesial outline of the tooth. So overall, the incisal surface, it is nearly straight. However, in the newly erupted teeth, you will see some protuberances, and those are known as mamelons, as you can see in this picture. So this is a picture of a newly erupted incisors, and in the newly erupted incisors, you can see these three protuberances on the incisal surfaces. So these are known as mamelons. So incisal outline, it is regular and smooth. So now we will discuss the palatal surface. The palatal surface is widely referred as the lingual surface. So from the palatal surface, the incisal and the middle portion, they are concave. So this is the palatal surface of the maxillary permanent central incisor, also referred as the lingual surface. So this is the incisal portion, and this is the middle portion of the crown. So the incisal and the middle portions, they are concave because of presence of this depression or fossa. This is the cervical portion. So the cervical portion, it is convex, and this convexity is present because of presence of cingulum. So this convexity is known as cingulum, and it is a rounded and smooth convexity. So now this is the mesial surface, and this is the distal surface. And because you can see this is sharp angle, so this is the mesio-incisal angle, and mesio-incisal angle is sharp, and this is a disto-incisal angle, and it is more rounded. So this is a distal surface. Two marginal ridges are present, and these marginal ridges, they are known as, this marginal ridge is known as the mesial marginal ridge, and this marginal ridge is known as the distal marginal ridge. This is the cervical outline or the cervical line, and the cervical outline and or the cervical line, it has slightly greater convexity or slightly greater curvature if you compare it with the cervical line of the same central incisor from the labial aspect. So from the labial aspect, if you compare the curvature from the palatal aspect, it is more. So from the palatal aspect, some additional features are, there's a shallow concavity that is present between the marginal ridges. So between the mesial and the distal marginal ridges, there's a concavity, and we call this as lingual fossa. So this fossa is known as the lingual fossa. Now the crown and the root, they taper lingually. So you can see part of the mesial side and the part of the distal side that is visible from the palatal aspect, because the crown and the root, they tapered in a lingual, on the lingual side. If you see the cervical line, it curves incisally. So this is the labial side, and this is the lingual side, sometimes referred as the palatal aspect. So you can see the cervical line. This is the cervical line or the cemento-enamel junction. So it curves towards the incisal surface. The incisor ridge, it is in line with the center of the root apex. So if you draw an imaginary line, so the central incisor, it is in line with the root apex. You can see here. So the incisal ridge, it is in line with the center of the root. Now the labiolingual dimensions. If you measure the labiolingual dimensions, they are more at the cervical third of the crown. So in this portion, the labiolingual dimensions, they are more as compared to the incisal dimensions, as compared if you measure from here. The shape of the crown is basically, it is triangular. So it is roughly triangular or wedge shape, and the root is cone shape, the blunt apex. The distal aspect of the tooth. If you see it from the distal aspect, the crown, it appears thicker towards the incisal third. If you see the incisal third, so the crown, it appears thick if you compare it with the incisal third from the mesial aspect. And this is because the height of the crown, it is less on the distal aspect. Now, the curvature of the cervical line, this is the curvature of the cervical line. It is also towards the incisal edge. So the curvature, it is less if you compare it with the cervical line curvature of the mesial aspect of the same tooth. This curvature is less as compared to the mesial aspect of the same tooth, the central incisor, I mean. From the incisal aspect, lingual surface, it is narrower mesiodistally than the labial surface. So this is a lingual surface, and the mesiodistal width is less if you compare it with the mesiodistal width from the labial aspect. So crown tapers basically lingually, distal side. So the labiolingual calibration or the labiolingual measurement. So this is the labial side and this is the lingual side. So the labiolingual calibration, it is more, 2/3 more than the mesiodistal dimension. So the labiolingually, the width of the crown, it is more as if you compare it with the mesiodistal dimensions. So these are a few of the important features of the permanent maxillary central incisor. Thank you for watching this video. I hope it is useful for you. Please do give me your feedback in the comments, and see you again. Bye.